Hello, welcome, and thanks for joining us to help choose home when care is needed. A podcast all about the benefits, value, and safety of receiving care and services in the one place that feels most comfortable, wherever it is that the person needing care calls home. I'm your host, Marilee Orsini, and I've been involved in healthcare at home since 1981. Before we meet today's guest, a brief thank you to our sponsors and partners, the National Association for Home Care and Hospice, Access, and Core Cubed. Today's episode is number 10 of Season 4. Our guest today is Dr. Jay LaBine, Chief Medical Officer for naviHealth, where he advances value-based care initiatives and has a focus on senior care. Please help me, won't you, and welcome Dr. Jay LaBine to Help Choose Home. First of all, let me just say thank you so much, Jay, for being with us today. It really is a pleasure, and I'm really excited to hear about naviHealth and about your involvement in the care at home industry.
Yeah, thank you, Marilee, and really appreciate being on your program and look forward to the discussion.
Good. Let's start with you giving us an overview of naviHealth, since that's where you currently serve as Chief Medical Officer.
Yeah, thank you. So naviHealth is a company that is a senior care focused company and works to manage post-acute care. So we're the largest post-acute care management company in the country. And this is really merely on that transition of care. So for patients, members who are in the hospital, they're transitioning into a post-acute care setting. And our core model is about managing the skilled nursing facility experience or the inpatient rehab facility experience. And then a small number of people also go through long-term acute care hospitals. And we do some management of that as well. And we work to give them a concierge type service that helps them through those settings of care and then back into home. I'd love to be able to tell you more about our care model if you have interest in that.
I actually think our consumer audience might have interest in that because this whole transitioning and coordination that is patient-centered, as I understand naviHealth's approach, is something that should be of interest to consumers.
Yeah, I would say it's even now more of an interest to consumers because of the impact of COVID on nursing homes. So many patients and families and caregivers are very concerned about what's going to happen to my loved one if they are in the hospital. And the recommendation is that they go into a skilled nursing facility. And early on in the pandemic, as you know, Marilee, the skilled nursing facilities were very impacted by COVID with many deaths and a lot of real tragedies in nursing homes. And so I think consumers would be very interested in, well, how are we protecting, members and how are we making things safe for people that are going into nursing homes?
I would love to know that.
Yeah. What naviHealth does is we are delegated the authority from health plans to help them manage this transition of care. And we do it in such a way that many times in that process, we would ask the patient, family, and even the nurses who are in the hospitals that are doing the discharge to home or discharge to the nursing home, we'd say, well, why not home? And the way our care model works is that we have 3 components to the naviHealth model. The first one, which I think is the most important, is we have care coordinators that are PT, OT, so physical therapists, occupational therapists, or RNs, nurses, who work in the nursing homes right alongside the staff and the nursing home staff members to ensure that the patient is getting a concierge type service or additional attention and care coordination as they're transitioning hospital into the facility and then when they transition home. The key point of our model is that we have a tool that predicts the functional gain for a patient that is individualized to that patient. So merely, if you were admitted to a nursing home because you had a hip fracture, we would compare people like you to a database of over 4 million members and patients. And we would look at what the best practice is and then set a benchmark for you, your family, the nursing home providers around what your expected functional gain would be and how long it would take for you to get to that gain. The real great thing about this is that it gives everybody a sense of how long things will take, and you can start planning for that return to home and return to independence way ahead of time. That's a real key part of our model. And then the last part of our model is that at the time of discharge from a skilled nursing facility, our care coordinator helps to ensure that we're connecting the patient member to additional services. So that could be community-based organizations like Meals on Wheels, connecting to their primary care physician, connecting to maybe it's complex case management from either the health plan or the health system. So naviHealth performs that function as well.
That's interesting. So if a patient has an expected gain or an anticipated gain that is not occurring, is there a part in the system that allows you to go back and recalibrate?
Yeah. So what we do is we use this tool in an interval. So every week we run the tool and we see, are you making the appropriate gains during your stay? And then if there's problems that occurred, and I'll give you one example, Mary, of a problem that our care coordinator identified. So this was an 87-year-old who had pneumonia and was being treated post-hospitalization in a skilled nursing facility, initially making really good functional gains that first week, and then all of a sudden didn't participate much in her therapy and was, I would say, quite withdrawn and depressed. Our care coordinator recognized that she, was no longer, she was really getting more and more depressed, had a conversation, and she said, well, I'm concerned that my daughter feels like I'm a burden to her and that after I get out of here, that she'll have to do more and more things to keep care of me, and that this is really weighing heavily on my mind, and I'm just very fearful of this, of being abandoned by her family. Then, of course, the care coordinator got the team together, got the daughter and shared this. And once some of that was resolved and there was kind of a coordinated plan for this, the patient felt a lot better and then was able to resume her kind of full functional recovery. So that's just an example of some of the work that we do in the nursing home.
And I've had several conversations with people about value-based care. And it sounds like to me, naviHealth is also focused in that space where you're providing value-based care.
Yeah. So the way that naviHealth gets paid is that if our outcomes and our member patient outcomes are good, then naviHealth gets the reward. So our financial model is we're 100% at risk for the PM of the post-acute care management. And so what that means is for facility care, some of our largest customers are health plans, Humana, United Healthcare, the Blue Cross Blue Shield, MA plans are all customers of ours. We have over 10 million covered lives that run through our platform. And we are 100% at risk for this PM of the post-acute care management. So when patients do better, we actually do better financially. In addition to the health plans, we also have customers in value-based care programs like the Bundle Payment Care Improvement Initiative Advanced, that would be the BPCI program. So we work with HCH, Tenant, and other large health systems to manage the post-acute care for the bundle payment program. And then we also work with some ACOs. So we are deep into value-based care.
And is there any way that a consumer, when they have a loved one in the hospital, could find out if naviHealth is a program that's used either by the hospital or the physician or their insurance provider?
So we generally are more B2B facing than consumer facing, but I'll tell you one of the things that on the consumer side, I think that would be really important for your audience is that naviHealth, we work with the insurance companies on a very large scale. So if they have insurance on one of the plans that we work with, they would almost assuredly get a naviHealth care coordinator to work with them. And at our website, there will be some information about like how to contact us and then I believe some of the partners that we have. So I would encourage them to go to our website to see if they have insurance that would be for naviHealth. The other thing that from a consumer perspective is we're doing more and more management beyond our core model. And I'd be happy to kind of go over some of the in-home management that we have on our roadmap.
Please do that for our audience.
Yeah. So the two models that we are implementing now, one is for home health management. And so Marilee, as you know, home health agencies are essential in the care transition when somebody doesn't go to an inpatient facility and they're going to go home and have a home health agency come to their home, help them with either physical therapy or nursing needs, and sometimes visits to do home assessments and then do things that could make their home safer. One of the things that we found is that there's quite a bit of variability because of the challenges of home health. So it could be in rural situations, there's, maybe limited number of options, or even in urban situations, there could be excess demand and it's hard to understand if the home health agency is performing, to a level that a member or patient would expect. So one of our new management business lines is in home health management, and we're just starting that now comprehensively with United Healthcare. So what we would do with that then is monitor, so it's a prior authorization for home health, and ensure that the patients are seamlessly getting from the hospital into a home health agency, and then monitor how the start of care is a timely start of care, ensure that the service delivery and that is meeting all the needs. And then we're actually going to measure the functional outcomes similar to how we measure it for skilled nursing facilities, but measure the functional outcomes when you have a home health episode so that we can continually improve the service delivery for home health.
Wow, that sounds wonderful. Dr. LaBine, I am going to switch gears here a little bit. I want to know a little more about you, and I think our audience would too. How did you become so interested in senior care?
Yeah, so it's an interesting story is that my training was in general surgery, trauma, and then I did for over 10 years, I did renal transplantation at a hospital in Michigan, and became chief of staff at that hospital. And as I was getting more and more involved with taking care of complicated renal patients, so dialysis patients, I got more and more interested in how to solve fragmentation of care issues with dialysis patients. And one of the things that was very evident was that these handoffs or these care transitions are very difficult to ensure that they're seamless and that nothing is getting missed. And so that was one of the first things that dawned on me, Marilee. And then in 2010, I had a career pivot where I became chief medical officer of a health plan that had a large Medicare Advantage population. Same system right there in Michigan. And I noticed that the health plan, because they finance so much of healthcare, you have an opportunity to implement programs that will, assist with decreasing this fragmentation of care. And that's where I met naviHealth, is when I was chief medical officer of the health plan Priority Health in Michigan, and brought them in, and we implemented this naviHealth care management program and found that we had great success in, when I say success, it was in the triple aim, right? So we provided a better experience for our members. We were able to show that the outcomes were equal to or better than what they were before we implemented this. And then we certainly saved costs, and we were able to take some costs out of the system with this program. So that's what initially got me interested in senior care.
And if you project out in the future, what kinds of initiatives or programs would extend even the benefits of naviHealth to allow people to know that they are being treated as a person, not a number, and also that their best interests are being considered when healthcare decisions post-acute are being made?
Yeah, so one of the things that we're kind of unique in is this: we have this high touch model where our care coordinators constantly give us feedback on how our operations are impacting people, right? And behind every transition, there's a person and a family that are concerned because a patient or a member is coming out of a time of crisis. They're in the hospital, right? And now they have to get back to, people want to get back to independent living and age in place. And we want to support that. So, Marilee, one of the most important things that we're doing now as an organization is we set up a patient navigation arm of our model, which is going to get extended onto that core model that I described. So patient navigation is a patient advocacy arm of naviHealth, where we identify for each individual some of their non-clinical factors that could be affecting their health. So as you know, this is a hot topic, right, Marilee, the social determinants of health.
Yes.
So, and the way I think about that and the way these patient advocates or patient navigators think about it is that they're there to engage with the patient and family, understand if they're living alone, if they have transportation issues, if they have food insecurity issues, do they have a primary care doctor? They are focused 100% on advocating for that person so that when they're discharged back into the home setting, this advocate stays with them and helps them stabilize over the course of 30 days or so. And with that, they break down many of these barriers, which are the social determinant barriers. The key performance metric that we monitor for this is, can we reduce readmissions back into the hospital, and can we reduce readmissions back into the emergency department? So those are some of that's a really important program moving forward.
And this, it sounds like, is something new. And are you finding success in using these care navigators to reduce those readmissions to hospital and ER?
Yeah, we're actually very bullish on this, because not only does it help with readmission reduction, because these advocates engage on the personal level, not just the medical level, we're finding that we can more effectively get them into other services that they need, but maybe were reluctant to entertain in the past. So an example of that is with, sometimes they're quite ill, and it's through this engagement and dealing with their non-clinical factors that will open up their, say, well, if you think I should entertain like palliative care type services or hospice type services, we're able to transition them and kind of refer to them in the appropriate way to those types of services. And I think that's a really important factor of what patient navigation does for naviHealth.
Well, it is only in our all working together to achieve a common goal that this is going to work, because as you know, we have a very complicated healthcare delivery system. Jay, did I not ask you something today that you thought I was going to, or is there anything that you would like to add as a closing thought to our audience?
Yeah, I guess the closing thought that I have around post-acute care is that, and it kind of relates merely to senior care overall, but even before, kind of the unprecedented COVID-19 pandemic, even before that, we had significant challenges in senior care, right? We had the baby boomers who were coming of age and, entering into Medicare at $10,000 per day, and then them aging and really wanting to age in place. And we had a system that wasn't, I believe, responding to this desire to have more services that they could easily access and be able to stay in their home. That's even before the pandemic. Now with the pandemic and some of the accelerators around, being able to have telehealth visits and have more and more capabilities of delivering care into the home, I think we have a tremendous opportunity to leverage our existing infrastructure and move it even more and more to being patient-friendly, person-friendly care in the home.
Those are words that are music to my ears. I just really so appreciate your time today. And more so, I really appreciate the refreshing approach that naviHealth is taking. And with you as the Chief Medical Officer, I see nothing but bright success in your future. So congratulations.
That is so great to hear. And thank you so much for having me. I really appreciate it.
Thank you. And you enjoy your day and take care. Thank you so much for listening today, and a special thanks to our sponsors and partners, National Association for Home Care and Hospice, Access, and CoreQt. If you have not done so already, please subscribe to our podcast and take the time to leave a review on Apple Podcast. We are now also on Spotify and most other places where you find podcasts. Like and follow us on social media and join us, won't you, to spread the word and help choose home when care is needed.